Well, good morning once again. We're here at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta, and we are here talking about dental medicine today. And we're going to talk to Dr. Gupta in just a little bit about the importance of wellness as it relates to oral care. But Dr. Bryan, again, great to be here, and this is really an important topic that we're going to be talking about today and really in the upcoming weeks too, isn't it?
Absolutely, Craig. Good morning, by the way.
Good morning.
Yeah, we're eager to kind of spread the message here of dental medicine and what we think we're all about. Obviously, we're general dentists, and obviously we think that's a very important part of our practice. But we also want to let people know that there's more to it than that, that we want to look at the whole person. We want to look at things that maybe they're not quite aware of that we as dentists can inform them about, and we can have a direct bearing on their overall health. So this is an issue that I think we can use this forum to kind of educate people as to what we can do for them.
Educating, inspiring, hopefully, and informing people. Doctor, thank you very much.
You're welcome, Craig.
And we're going to talk. All right, we're going to talk to Dr. Bryan even next week about some of the particulars about dental medicine. But today, Dr. Gupta, wellness, and that's a big issue, especially in dental care, isn't it?
It sure is, Craig. And if you want to follow me into our preventative care treatment room, where our dental hygienist performs the 6 months cleanings. So if you want to follow me in there, I'll tell you a little bit more about it.
Let's do that. Let's get a good look. Okay, we are here in the preventative care treatment room with Dr. Anjana Gupta. And Dr. Gupta, we talk a lot about wellness here on the program, and especially during this segment, wellness and oral health have a lot to do with each other. They kind of go hand in glove, don't they? That's
exactly right, Craig. In this area here in our office, the preventative care treatment room, this is where the dental hygienist works. So this is the room that you'd come to when you come for your regular 6-month cleaning, as we talked about before. One thing that I wanted to touch on that I feel really strongly about is we're hearing a lot these days about the mouth-body connection. And there's lots of new research out there that supports these theories. And one thing that we look for, especially when you're a new patient in our office, is we take a look at your overall medical history. Some specific systemic diseases that we look for are history of cardiovascular disease, history of diabetes, osteoporosis, things of that nature. And a lot of people ask, well, why does my dentist need to know that?
Right.
Well, it all comes back to this mouth-body connection. For example, a patient with cardiovascular disease, a person with periodontal disease or gingivitis is twice as likely to have a heart attack than someone who doesn't have periodontal disease.
No, why is that exactly, Dr. Gupta?
A person with periodontal disease has oral bacteria, bacteria in your mouth, and that bacteria that's in your mouth has a higher chance of getting into your bloodstream. Bacteria in your bloodstream gets into your heart, gets into your arteries, sure, and can aid or lead to blood clots forming, which everybody knows that blood clots are what lead to obstruction of the arteries or cardiovascular disease, which increases your chance for heart attack, stroke, things of that nature.
Well, Dr. Bryan, last week even, or a couple of weeks ago, talked about the importance of a healthy, good-looking smile, and that is important.
Sure.
However, you're saying it goes way beyond that, and what you've just said is a perfect example and reason why.
Way beyond that. And I really think it's something that dentists and physicians need to work together on, because everyone wants that bright, white, nice smile, but it goes much beyond that. If you're a person that has a history of diabetes in your family or a history of cardiovascular disease, it's real important that you see your dentist every 6 months and that you maintain a good oral health, because why would you have an added risk if you didn't have to?
It's not just a sales pitch. You really do need to see your dentist often, and that's the purpose for this segment here. When we talk about dental hygiene and wellness, we're talking about things that go well beyond the smile. And the headline here, Dr. Gupta, is that people really don't need to floss every day. I love that. They don't need to floss every tooth even, right?
Only the ones you want to keep.
Only the ones you want to keep. Dr. Gupta, thank you very much.
Thank you, Craig.
Folks, if you'd like to find out more, you can go to our website at myfresh.tv or log on to the website here at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta. We'll be right back. Stay tuned.
Up next on Fresh, Jonathan and Courtney at Garber's Decorating Center.
We're here at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta and talking about dental medicine here on our segments. And Dr. Gupta, when a person first comes in, they're going to be treated to a really great wellness checkup, aren't they? And tell us a little bit about what that entails.
They sure are, Craig. The one thing that I hope that the patient feels that we're doing here on their first exam is doing a very thorough exam. I hear that often from our patients that they feel like they've had such a good first exam. And one thing that we do is we obviously take full sets of x-rays. We use the intraoral camera that you can see here. We take pictures of every tooth, take pictures of the smile. We have a small laser here that we can use to detect cavities. We do an oral cancer screening. Basically just talk to the patient and decide what they want and what their desires are and what we can do to make them feel more comfortable.
All right, folks, you heard it here from Dr. Anjana Gupta. If you'd like to find out more, go to the website or give their office a call. The information's on the screen.